Hi, this is Jill Murphy from Contemporary Clinic. Today I'm speaking with Jessica Peck and Jennifer Sonney from NAPNAP about their recently published study titled Exhausted and Burned Out, COVID-19 Emerging Impacts Threaten the Health of the Pediatric Advanced Practice Registered Nursing Workforce. How are you doing, ladies?
We're doing great. Thanks so much for having us, Jill.
So glad you guys could join me. I wanted to ask you first, both of you could take this. Just give me a quick overview of your backgrounds and how you got to where you're at today with NAPNAP.
Sure. Well, I'll go first. My name is Jessica Peck. I am currently the president and finishing my term as president of the National Association of Pediatric Nurse Practitioners. I have been a pediatric nurse practitioner for almost 20 years, which seems hard to believe, in primary care, and have always maintained a practice in primary care, but I also teach and have taught at several universities in Texas and currently teach at Baylor University in the Pediatric Nurse Practitioner program. Have 4 kids of my own, so I always have to give a shout out to them. They're my inspiration for pediatrics and love everything that we're doing in pediatrics. So that's me, Jen.
Sure. I'm a pediatric nurse practitioner, primary care as well, and have been for over 15 years. So I've always worked in general pediatrics and spent a number of years where I actually developed, implemented, and managed a pediatric asthma clinic for disadvantaged youth. I then went on to immerse in academia as well. I'm at the University of Washington School of Nursing, where I have a multi-mission role that includes teaching, research, clinical, and service responsibilities. I've had the privilege of serving as the secretary at NAPNAP for the last 2 years, and in July, I will begin my term as president-elect. So I would say working as a PNP has shaped my entire career trajectory and really that passion for promoting child health equity.
Absolutely. And with this study that you both worked on, what do you think inspired you to both focus on this specific topic, since COVID has caused a lot of things to shift in your area?
Sure. Well, it was definitely concerning to us as leaders in the organization. How is COVID impacting our workforce? And we were starting to see a lot of surveys come out from different nursing organizations that talked about the impact on nursing in general, but we really weren't talking about the specific impacts on pediatric nursing. And of course, nursing has been the face of the COVID-19 response in the year 2020, the year of the nurse and the nurse midwife. And although nursing is 4 million strong and the largest and most trusted health profession in the United States, we have a smaller portion of that that's pediatrics. And the dialogue on pediatrics has been interesting because while children have generally been spared from significant physical complications of COVID-19, if this disease was impacting children like it's currently impacting adults, I think our national narrative would be a lot different. But even though their physical disease burden is not as great, they are by no means spared. And so as pediatric nurses, we are dealing with a lot of new challenges that we just frankly haven't dealt with before. I mean, the pandemic conditions have fundamentally altered the norms of pediatric care delivery, and we have collective concerns as a profession. There's severe COVID-19 in children with pre-existing conditions. Children still do get very sick from COVID, and some children do die, and that's always concerning to us. We're looking at multi-system inflammatory syndrome, disparities in illness and death, particularly for children of color who account for 75% of pediatric COVID-19 related deaths. We're also concerned about free-falling immunization rates. And as a profession, many of us are just frankly working more for less compensation. We're isolated from our professional networks. We are learning new technologies at the speed of light and implementing new policies in very little time with very little support. In school-based or primary care, we're just trying to hold on and make ends meet because we have decreased access to those care environments. Or some of our colleagues are in acute care environments where children's hospitals are receiving less than 1% of all federal relief monies provided to US hospitals. And then the most talked about thing, of course, is mental health impacts. Everyone is asking the question, what is going to happen to our children? What is the long-term impact? How is this going to shape our future? How are we going to respond? Because we know that children are isolated and lonely and spending more time online. We know that we're seeing increased presentations of mental health concerns from children, parents, and providers. And so all of those things really just honestly make our hearts hurt. And as pediatric nurses, we're we're really thinking about our own personal mental health stressors. And so we see that the workforce is exhausted and this is just not sustainable. So as an organization, and with Jen and I leading, we really wanted to commit ourselves to support a high quality, accessible, affordable care continuum for pediatric patients and protect and support our workforce pipeline. And so that's what we sought to do, to say, okay, we know from talking to our colleagues that there's an issue here. What really are those issues and how can we respond?
And Jennifer, was there any highlights of the study that you felt were the most eye-opening or interesting that Jessica didn't mention?
Yes, there were quite a few highlights. First and foremost, that we had almost 900 respondents, which is record-breaking for NAPNAP. So we know that this is an issue that people were passionate about and eager to contribute their own personal experiences so that we could really have a national narrative about what was happening. I think the most alarming finding was that 73% of our study participants reported increasing presentations of child mental and behavioral health concerns. And as Jessica mentioned, we suspect the cumulative impacts of social isolation, loss of social safety net services, family stressors and trauma, deferred care, that all really have contributed to this surge in mental health needs. Evidence also indicates that marginalized youth are disproportionately affected. So we know, based on these study results, that we need to take swift and sustained action to address these needs. Another really alarming finding is similar in that there are mental health needs of our own respondents, our colleagues in the pediatric APRN workforce, with more than a third reporting feeling professionally burned out, a quarter of them reporting anxiety, and 15% depression. Somebody commented, "I'm so lonely these days, it's hard to breathe," which clearly shows that our workforce is experiencing a similar surge in these mental health needs. And a significant portion are feeling burnt out, which really threatens not only our workforce, but also the care access for children. And then finally, I want to highlight the impact the pandemic has had on APRN education, with 70% of our educator colleagues reporting moderate or extreme concern over clinical training site availability, preferably established. We don't compromise those. So when you don't have site availability, what happens is you delay graduations. And ultimately, delayed graduations constrain our workforce even more. So when you consider this all together, the cumulative impacts of COVID-19 have really led to a surge in pediatric mental and behavioral health needs. Our pediatric APRN workforce is suffering and facing burnout, and we have a constrained pipeline of graduates, which paints a very serious picture.
Definitely. And with that being said, is there anything that you both hope to study more in the future regarding nurse practitioners in the workforce with everything that you just found through this study?
Yes, Jessica and I both agree that this study is just the beginning. Our first priority was to understand the scope of the problem, which was the overarching aim of this study. And so we're now working with NAPNAP leadership and collaborators to respond. And we know we need to be swift in that response, but also sustained and multifactorial. So for future studies, we need to continue to evaluate the impacts of the pandemic on our workforce. The pandemic isn't over, and we know those impacts will endure and likely evolve. We also anticipate a follow-up study to further delve into those impacts as they evolve. And then looking at the efficacy of NAPNAP's response, what worked, what didn't work. And our findings will inform this response and hopefully help us to continue to evolve those needs of our members and the children that we serve.
And what is the general message that you want to give to other healthcare workers and nurse practitioners from these results specifically? And what do you hope the solution is to all of these concerns that you found?
Well, Jill, that's a really great question. And I think first and foremost, the message that we want to give to our fellow colleagues is that we see you and we hear you. We see your struggles and we feel your pain and we hear your cries for help. And we want to honor the sacrifices that have been made by the healthcare workforce in the last year to provide care, because every nurse in the healthcare workforce in the last year has made significant sacrifice in providing service to our to the people that are around us. And it's really great because the public loves nursing and they want to help. And so we've been inundated with cheers and songs and free coffee and sidewalk chalk messages. And these are really lovely gestures and they really do warm our heart. But they're really not enough to face the crisis that nursing is facing right now. The truth is that COVID-19 has illuminated fissures in the US healthcare system and cast a spotlight on health inequities that we've known about for a long time, but now we really know about them in the public eye and we will respond. The Future of Nursing report that just came out from the National Academy of Medicine is focused on that, on health equity, and we are doing that too. And really what we want to do as an organization is to elevate the voice of nursing so that it gets equal attention and respect as the care of nursing. Everyone wants to see us, with the mask marks on our face and, wiping fevered brows, which we do all of that too. But nursing is a scientific profession of highly educated scholars. We are experts, we are leaders, we are care practitioners. We are ideally positioned to provide voice and influence for pandemic preparedness and response. And so we need to assess and respond to the pandemic-related trauma that we've endured. And we have to prioritize programmatic efforts to cultivate holistic wellness. And so that's really what we're doing with our COVID-19 response task force, is looking at what do we need to do now to respond to the workforce, and what do we need to do in the future so that we are better positioned and better prepared. Really, as experts in pediatrics and advocates for children, we need a seat at leadership table to guide those systemic, sustained, and effective responses to the crisis. But I would want to leave everyone with this message that nursing is a resilient, innovative, and tenaciously hopeful profession. And I am confident that we will come through this stronger together.
Absolutely. Jennifer and Jessica, thank you so much again for joining me today.